everybody. I'm Maggie Yu, MD, functional and holistic medicine physician. And I want to point out to you guys today, we actually have a really special interview with 3 medical providers that are on the front lines right now. And they have a message for everybody with autoimmunity and immunocompromised. So make sure you stay tuned and watch. And for those of you that are watching on YouTube right now, make sure you subscribe and notifications so you get regularly notified of the videos that are coming live. And we're putting out content regularly during these challenging times right now. And those of you that are watching from our regular Facebook page or on Facebook, make sure you join our Facebook group, Transform Autoimmune Disease Naturally right now. That's a mouthful. Transform Autoimmune Naturally. Go ahead and just find that on Facebook and join our group right now. I am going live in there regularly. We have so much content in there and it's free. Do that right now. And I hope you guys enjoyed this interview as much as I did. There's some timely and important information for you, what you guys can do to protect you and your family now. We have us today a panel of special guests, healthcare workers, and most of which all of us, many of us in healthcare now are on the front lines. And I want to actually do an interview asking some of the healthcare workers here that have been through our program what their observations of what's going on now is, where they are with their autoimmunity, and they have a message. I'll have a message to any of you out there with autoimmunity or who are immunocompromised they're taking to make sure that they're in the best shape of their lives to deal with prevention and early treatment of dealing with infectious threats dealing with right now. So I'm going to ask each of them to introduce themselves, and I'm going to ask them to quick minute, and we'll go in alphabetical order. Amy, all yours.
Hi, Maggie. My name's Amy Bball. I'm an RN. I work in long-term care. And so I work with a pretty vulnerable population. I graduated from the program about a year ago. And right now I am pretty much symptom-free from all of the autoimmune stuff that I came into the program with. I came in with mast cell activation disorder, POTS, and some pretty intense vertigo. And so all of that stuff has completely cleared up. It's been gone for months and months. I did have a major surgery in November, which kind of put me back just a little bit, but I was actually set up really well to deal with that. And I feel like I've regained all of the ground that I maybe lost just a touch of after that surgery. So I'm actually kind of coming into this, coronavirus outbreak is sitting in a pretty good position actually right now.
Thanks, Amy. Julia.
Hi, I'm Julia Montgomery. I'm a registered medical sonographer. I currently work in a vein clinic and I scan people with my hands every single day. I'm a current graduate of the program and in just 3 short months, I have completely changed around my entire health outlook through the 5 pillars that Maggie teaches. I was able to stop the advance of my dermatomyositis, and I had found out just recently I have underlying lupus and my thyroid's under attack. So I feel like that I'm very well armed. I have just a new path to take. I know what to eat and what not to eat. I have supplements I take every day. I feel amazing. Better than I have in over a year and a half. And it's going to be a continued work in progress, but I think I'm on the right track.
Thank you, Julia. How about you, Meredith?
Hi, I'm Meredith. I'm an RN in the emergency room, unfortunately, right now. But right now we're working on the front lines and it's kind of tough because we don't have masks or PPE that we should be having, but we're doing the best we can. I came into this program with a diagnosis of RA, and I'm leaving with a new diagnosis of Hashimoto's. When I came into this program, my pain was 10 out of 10, and I felt like I was 90 years old, and my pain is gone. So I'm feeling great, and I feel like I have my immune system working at optimal levels right now. It's working for me, not against me, and I feel like I can definitely take this coronavirus head on.
All right, everybody. So I have some questions because you guys are medical providers on the front line. Obviously, we're going to be talking about, we have a message for people who, our audience is people with autoimmunity. There's a lot of people that are immunocompromised. And I think as healthcare providers, we have a unique perspective to be able to provide to them how we're arming ourselves. What have we done proactively, strategically? Some of you just, 8 weeks ago. I mean, recent graduates, this just started 8 weeks ago. Amy, this started a year and a half ago for you. So I'm going to start with a quick question, and anybody who can answer could raise their hand, which is, how important do you feel that, our program is online? You completely are able to do it online from the safety of your own home. And I and our team, medical team, is training you guys and all our clients on how and what they can do using their own data to turn things around. How crucial do you think, I mean, we're 3 years ahead of, we've been doing this program online for 3 years. So we're 3 years ahead of everybody else trying to get online right now, desperately. And so my question was, how, I guess, crucial was this for each one of you in dealing with the current threat right now? How important was it? And Amy was a year and a half ago, Julia's right now. Julia, for you, what do you think, how do you think it made a difference or not?
This was instrumental. There is not anybody in my area that even would touch the natural approach to autoimmune disease. They're all just stuck in their own little specialties, and there's nobody around here that'll even talk about it. So this was very important to me. It's part of my philosophy that I've had for years and years, that there's got to be a natural way to do things. And this is it. And this was wonderful that I could connect with you in Oregon from Houston.
We have clients from Australia and India and England and Ireland right now.
Oh my gosh. And just the fact that everything was online, I could do the modules at my own pace, and that you guys were there every step of the way, that if I needed you, a question, the mastermind calls, the community, so much knowledge has been downloaded. It was instrumental in my turnaround for sure.
What's interesting when we're talking about Corona right now, or any sort of viral threat right now, is that there really is not any treatment out there for this right now, and nobody has natural immunity to this right now. But interestingly is that there is so much in natural medicine and even supplementation. There's so much that's data driven. And a lot of people think natural doesn't mean data or science, and our entire program is data and science driven data. And we're all medical scientists, we're all medical providers here. So we know better than anyone how important data is. So Julia, thank you for pointing that out, the ease of access that people have to just an incredible team and the use of data in this. Amy, you look like you were about to say something.
Yeah, so one thing I really liked about your program is I didn't even have to leave my house to do testing. All of the testing was done from the comfort of my own home. I literally didn't have to make an appointment somewhere. I know a lot of clinics are closed right now. Access to lab would be really difficult for a lot of our nation right now. So the fact that you can do everything pretty much from home is really, really nice.
Yeah. And Amy, you're coming to, I think, quick chat yesterday, you may currently have symptoms of COVID or no? What's the update on this right now?
So I had been sick 2 weeks ago with a fever, low-grade fever, congestion, chest congestion, just kind of some of like the milder symptoms. I did not get tested because I did not meet criteria. Testing is really difficult across the country right now, and test supplies are extremely limited, and they really are truly only testing the people who are really, really seriously sick.
Well,
go ahead.
Go ahead, finish.
However, I took a week off of work and laid low, and then now, a week went by and I felt pretty good. And then of course this week now I noticed my lung symptoms kind of starting to increase. So I did end up going back to my doctor, and he said, it's very likely you did have this bug and you're still dealing with it. I haven't had a fever or anything like that, and my symptoms are pretty well controlled, but I really do attribute that to the fact that I know exactly what to eat. I know exactly what supplements to take, and I know exactly how to, like sleep hygiene. There's just so much more to it than just simply running to the doctor and getting a coronavirus test and testing positive. Because really, truly, a positive doesn't really make much of a difference. If you're not seriously ill, they're going to send you right back home and tell you to treat yourself at home.
So,
but I have a lot of tools.
And I was thinking about how right now, Amy's freezing up a little bit, but she'll be back on. I was thinking about is that, and truly right now, what the science and data is telling us, this is not like there's some magic drug. It's not like there is something magical they're going to do for you in the hospital for most people that are coming down sick. So let's think about prioritizing and think about, what do you think if anyone has autoimmunity, is in a flare right now, or has frequent flares and is going into a flare? What do you think should be the number one priority in their health right now? I know everybody's scared about COVID and all this stuff, but I've said this, and I don't know if you guys agree with this, which is me, the biggest threat to you right now isn't even COVID or getting an infection with COVID. It's actually to deal with the current flare, to prevent any future flares, so you don't end up in the hospital or ER and be exposed to all that at the worst possible time. That to me is the biggest threat to your health, not COVID. It's your autoimmunity and the flares that you're in right now, or to prevent. What are your thoughts on that? I mean, Amy, you've been out for a year, and Julia, Meredith, you just graduated. So I'd love some feedback on that.
So I personally haven't really had any flares other than right after surgery. I had just a very minor skin flare, which I anticipated a much bigger flare. So I was really, really happy with the fact that my autoimmune going into a trauma was very well controlled for the most part. I recovered very, very quickly. And so really, truly, that gives me really good insight as to where the state of my health is, because prior to this program, I probably would have had a 6 to 8 month recovery time, and I had about an 8-week recovery time, which is anticipated for that surgery.
Woo, 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 woo. And that's the thing, is a surgery is a physical trauma and threat that could put a lot of people into a hell of a lot of flares. You know, the normal person would have taken 6 to 8 months to recover from that surgery, much less a person with autoimmunity that's had flares in the past, right? So it took you, what, 6 to 8 weeks instead of 6 to 8 months. Boom. My question for Julia and Meredith is, in the past, when you've gotten sick with upper respiratory infections, how bad were they, and how frequent did you get sick, and how bad was the severity? I'm just wondering, and because for me, I have asthma, and when I used to get sick, my closest to being hospitalized was for asthma attacks after colds and cold and flus. But luckily, strategically, in the last 10 years, I haven't had one asthma attack with colds or flus, because my autoimmunity, my immune system is prepared for this. So that's life-saving, especially given something, a virus like this. What about you, Julia?
Okay, well, I used to, until this year. It's not quite over yet, so knock on wood. But I used to get chronic sinus infections, always, at least in one side of my face. I have a small deviated septum on this side, but so I'd always get sick on this side. And of course, I'd have to neti pot, and it would last for a good 5 to 6 weeks. Every spring, every fall, I'd go through the same thing. So far, so good. I've had the hums because the pollen, it's full-blown spring here in Houston. So there's pollen everywhere. And I've really just had just a little bit of and that's it. My sinuses have been clear.
Is this the best allergy season, early spring, you've had in record?
I'm going to say yes. Yes.
Hell yes.
Ever.
ever. But that's what this is typical outcomes from our program. People with allergies, asthma, mast cell disorder, like chronic sinus infections, already within a couple weeks in our program are seeing the least allergies they've had, are seeing the least asthma symptoms, the least amount, their eczema or skin is already improving. And this is within a couple weeks. So that's the best shape to go into any infection threat right now.
It's just amazing.
Yeah. Meredith, what about you? Any sort of allergies, cold, upper respiratory issues before going to our program?
My allergies were awful. I mean, I would have a leftover inhaler that I would use, and I would just be constantly sucking on that thing just so I could breathe. But so far, so good. I haven't had any trouble this year. I haven't had pneumonia, no sinus infections. I'm doing pretty good.
I love it. I do have a practical tip for everybody that is watching. If you do have a history of asthma and you are on inhalers, I do think it's a good idea to make sure you check that you do have an inhaler at home. And if you don't, do call your doctor and try to get a prescription of it so that you have one at home. That's important right now. Especially we're dealing with an upper respiratory virus that specifically attacks the lungs really strongly. So that's a really good piece of advice. I'd love to share, a lot of people want some nitty gritty. What do you think you've done in the program? What was a major turning point or aha in the program that you felt like really turned around your immune system to work for you? And the person is different and your data is different for each of you. So I'm curious, each of you, what was your biggest ahas and takeaway?
Mine was food mapping. Food mapping and running my blood numbers was huge. I found out I had several IgG allergies that was perpetuating all of the inflammation that I was having. And looking back, I can see with 20/20 vision that these things have been progressing for years before my skin decided to give up. So yes, those were humongous data points for me.
For those of you that aren't familiar with food mapping, it's a unique process that we do in our program. Specifically, it's super helpful for people with autoimmunity and immunosuppression to have accurate testing and data. Anyone can use the testing, but specifically for a challenged population where their immune system can have hyperreaction or underreaction, the testing we specifically use in our program is optimal for that. But this is a test we can send out from the comfort of your own home, to do at your comfort of your own home, sending it back to us. So my question, one of the things I want to talk about is in a system right now where it may get harder to go out and get food, and our food choices and options might be limited. I guess to me, how important do you think it is to know, based on what foods you should and what all the foods you could add back in? I guess how important would that be in your ability to procure food safely and effectively for the rest of this challenging time?
Huge.
And Amy, how much difference do you think you're at farther with food for you and your family right now, because you know this? You're a year and a half out.
Oh, it's huge. It's totally different. I was down to eating probably only 10 foods when I entered the program, because I didn't know which foods were causing my reaction, and I was eating one specific one on a regular basis that was perpetuating, and obviously didn't know it. Yes, Julia, that was me. And when I found out what those were and I removed those, my entire diet opened up. So I am now able to eat all but maybe one or two foods. And so it's really, it has really opened up the opportunity to eat other things. So I can go to the grocery store and I'm not stuck with, the 5 or 10 foods that I am so reliant on, and maybe those are sold out. Now I have a huge option to go, I can go throughout the entire grocery store and build meals based on what's even available.
I love that, because the other piece is those nutrients specifically, that all these phytonutrients and vitamins that you need to actually prevent or treat early upper respiratory infection are precisely based on variety of foods. You want a variety of phytonutrients and nutrients from your food. And imagine if you were right now eating 10 foods. Where the hell would you be with that?
Starving. Yeah.
Well, starving, you might be full, but you might be starving nutrient and immune protection wise.
Or literally starving because there's nothing on the shelves.
Right.
Yes, that is true. Literally starving. Okay, so food mapping, Julia, that was great. Anyone else have other linchpins that you feel has been really crucial? Meredith?
Blood sugar. I was eating like chicken and lettuce, and that was it. And other than that, I wasn't eating. So I was like starving myself because I was afraid to eat. And then when I got my food mapping back, I could add everything back in because my only problem was dairy.
So this is important, because I love this, because you're adding variety in, but here's the thing that feeds any infection the most is sugar. So for those of you, a lot of people are carb loading, snack loading right now, but it's not just about cutting sugar. We talked about this. It's about how do you prevent the high and lows. It's these swings of blood sugar that's triggering the autoimmunity and killing your immune system. So how do we get blood sugar to be stable throughout the entire day? I call that blood sugar wave balance. It's not about cutting sugar. It's about how do you get blood sugar balance and stable throughout the entire day to prevent the spikes of up and down. say, oh, that's old news. That's no big deal. I've been doing that for years. Okay, medical professionals, I mean, everybody graduating out of our program says blood sugar was the most important piece, and I want to ask Meredith, how do you answer people who says, I got that. I got blood sugar, no big deal.
It's way more than you think it is. It's so much more in depth. I don't know. It's just, I used to think that I had a grip on it, but I definitely didn't.
No, I didn't.
And we're medical professionals here.
Oh yeah,
supposed to know.
we're the people that's supposed to know.
And so many people are like, I'm an expert on Google, researched all of this. I know. Excuse me, we're actually medical experts. We're actually medical providers here. And I myself didn't know until I went to community. And
Dr. Google will always give you cancer.
Yes.
Well, and the cool thing is we have an online functional nutritionist. We go through food journals. We actually have online modules to teach you how to do this. I feel like we literally give you the tools within 1 to 2 weeks to be able to get perfect blood sugar control if you're ready to do it.
Yeah, it's true.
Okay. Any other linchpins, anyone?
I think for me, mindset. Mindset was huge. I did not know how much I stood in my own way and how many things in my entire life holistically were impacting my personal health, and how crucial boundaries were, how crucial it was for me to decide that I needed to take care of myself and not just everyone else. And being able to stand up for myself and being that advocate to be able to move my health forward. I was standing in my own way, and I really needed someone to point that out to me. And it was really interesting that was brought to my attention, and it literally dropped me to my knees. I was like, oh my goodness, I have literally been standing in my own way this whole time.
So this is a really good point, because I think what people don't realize is the role of stress and anxiety in destroying the immune system. And there really are mechanisms with cortisol levels, with blood sugar, with, gut bacteria and depression, how that really, there's tons of data around how physical, emotional stress can destroy your immune system and immune response. So my question is that you bring up a really good point, which is we do powerful mindset work to help you actually change the patterns with which you're thinking, so that you can actually rewire your brain to actually help decrease stress levels, to actually improve your immune system, calm your autoimmunity, and be able to actually deal with, like, physically, like, be healthy relationship wise with people in your family, and right now in the workplace as well. So I want to point out something. This is a conversation I had with our mindset coach, which was as healthcare providers, and anyone out there who's a pleaser and giver, this is a very challenging time for us, because the amount of demands for us that are givers and service providers is going to go up. And our desire is want to say yes, yes, yes to everything. And one of the most important things for any pleasers and service providers out there, I don't care if you're police officer, teacher, food service worker right now, what you say yes to is important, but what you say no to is even more important, because it gives us the consistency then to be able to continue to serve. I was just talking to a crisis counselor, and they're dealing with his crisis counseling. And one of the things the director told me was that she found that the crisis counselors who said yes to everything burned out within a week. And they were dealing with a crisis that was lasting about 2 months after a really traumatic event. And they said the crisis counselors who actually was able to say, no, I can't work 16 hours. No, I can't work from this weekend or this evening. 2 months out was still able to serve the families of those people that were involved in this trauma. So I think that these boundaries that we're talking about is applicable not just to your autoimmunity and your health, is particularly pertinent right now in how we service the greater society and dealing with this challenge right now.
Agreed.
Absolutely.
Okay, great.
Self-care.
It's real self-care and healthy boundaries. Okay, to wrap this up, I want to anybody who's watching right now, if there's alumni that are watching right here, if there are other healthcare professionals that are watching right now, can you write in the comment section, what's the biggest takeaway, or what's something that really resonated with you? Comment in the section below right now. What are some things, key points that our medical providers here on the front line have given you that it's like, aha. And if you're also a first responder or a medical provider or people who are working at the front lines and you have other additional observations that can help our viewers, please put it in the comment section right now. Alumni that have been through our program, please tell people how this online experience for them, because this was new for a lot of people, but now it's the new reality, and I'm glad we've been doing it for 3 years. Tell people what your experience in the program is. For those of you that are watching on YouTube, please subscribe to our channel and click notifications so you get notified every time we have a new video. These are coming regularly. And to work with us, you can go to drmaggieyu.com and and you can watch our free online training and talk and get on the phone and talk with us so we can see if we can work with you now. Any last pieces of advice, I guess? I want to ask if all three of you had an advice. We have a lot of people right now with autoimmunity and immunocompromised who are scared shitless right now. And you know, and I am fully aware that a lot of them are not in our Facebook group. So please join Transform Autoimmune Disease Naturally right now in our Facebook group. I'm going live in there regularly, tons of free resources right now. But from you guys, what one piece of advice you can give people out there with autoimmunity who are immunocompromised right now? And we'll go alphabetical with Amy first.
I would say arm yourself with the knowledge that you need and making sure that you're getting your information from reputable sources so that you are making an informed decision about your own personal health care. You cannot make good decisions for yourself and your family if you don't have correct knowledge. And right now there's a lot of misinformation out there on the web and, you know, in social platforms that is perpetuating that the healthcare community is watching happen, and it's causing panic. And really, truly, if you are armed with the correct knowledge and the correct data, you will be armed to handle this situation without having to panic.
Yeah, thank you, Amy.
Okay, so my advice is please don't give up. There is a way to control your autoimmunity naturally. It's just like Amy said, there is ways to get great information, correct data-driven knowledge base, so that you can take control of yourself. You don't have to roll under for all the doctors that want to give you this chemical and that chemical. Obviously, don't go off your medications until you start a good program like this one. This is a very good one. I'm very happy.
You know, Julia, you really good point. A lot of people are on with autoimmunity are on drugs that even suppress the immune system even further.
Yeah.
Well, they're at greater risk. So it's even more important for them to arm themselves with all the other tools that they can get besides those immunosuppressant drugs.
Some of those side effects.
Not to stop it, but there's so many other tools you can do to add to it. Either at some point be able to decrease those drugs, you know, or while on it, you can it boosts your immune system while you're on immunosuppressants. There's so much they can do that they don't even know about.
Exactly.
Julia, that's a great point. Meredith?
My advice would be to turn off the news. I think the news is making this such like a hysteria, and it's scaring the heck out of everybody. So I think if we turn off the news and we find a reputable source to find your information, learn all you can about it, but don't freak out. And then turn the news off, get outside, get some fresh air, take some time to de-stress and take care of you. Eat well, stay hydrated, lots of water, pick good foods that are good for you, you know, high in vitamin C, healthy sleep habits, and just stay positive. You have to get out of your own head and you have to stay positive during this.
God, that's so powerful. Thank you so much. And what you're saying, Meredith, is you need a strategy.
Absolutely.
You need a strategy. You cannot allow external factors like the news watching the news is not a strategy.
No, definitely not. Not unless you want to panic.
But people are spending like 10 hours watching the news and that's their strategy. It's disarming them. You have the time right now. A lot of you said you didn't have time, and now you actually have time. Now, what the hell are you going to do with it? And a strategy is not watching the news, being reactive.
Exactly.
It's being proactive, getting yourself
Right.
educated, being proactive, reliable sources of information, and also choosing to spend time with those sources rather than some crazy sources out there. I love it, everybody. Thank you so much. And for all of you, if you want to learn more about our program, you can go to drmag.com and watch our training and join our Facebook group, Transform Autoimmune Disease Naturally. We have staff now in our Facebook group to interact with you guys in live, real time. So go in our Facebook group and join it right now. Thank you, everybody.
Lupus, lung fibrosis,
Hashimoto's thyroiditis,
fibromyalgia, AS, which is a form of arthritis,
Epstein-Barr, extremely fatigued.
pretty much zero joint pain.
Much more happy.
I don't have brain fog anymore. How much weight I have lost.
I want to say remission.
Maggie and her approach is very different than the traditional doctor. I'm a totally different person.
I got a better understanding of what those intolerances were.
You're not alone.
The community is, I'm learning from everyone else's issues.
It's not just helped me, it's helped my entire family.
We are transformed.
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 Join the movement and transform your autoimmune naturally today.